Yes, on YouTube we are 300 and it's rising, so I think we are ready to go, ready to start. So I will hand the microphone to you, Bernhard.
Okay, I'm hearing an echo, maybe because someone has the YouTube stream running at the same time and is not muted, but I'll start anyway. So my name is Bernhard Schirkhoff. Okay, I'm hearing an echo myself also. Can people mute their... I'm hearing an echo. Use today's Max Planck lecture, which will be given by Yoshua Bengio. So as you probably most of you are aware, this has a bit of a complicated story. We had announced Jeff Hinton to give this talk today, and Jeff he promised to talk about something which was hot off the press, some rather new work that he was very excited about. But then recently he noticed there's still an issue with his work and he didn't feel comfortable talking about it. So that's a normal risk in science, where you work on things that we don't know for sure whether they will work out or not. And we fully understand that he wasn't comfortable talking about this. Initially, when we had secured Jeff's talk, we decided to attach another online event after the talk, which was going to be a meeting on a small scientific meeting on contact tracing technologies and the use of machine learning for contact tracing in COVID-19. And this was going to be a meeting between CIFAR, the Canadian Institute for Advanced Research, and ELIS, the European Laboratory for Learning and Intelligent Systems. And the good thing was that this meant that Yoshua had already blocked the date and was available at very short notice. And he saved us, and we asked him whether rather than giving a short talk in this workshop, he could give a long talk, the Max Planck lecture, a little bit earlier. So I'm very grateful, we're all very grateful to Yoshua that he stepped in. Of course, Yoshua doesn't really need an intro, but I'll say maybe a few personal words anyway. So I met him quite a long time ago when I was a PhD student at Bell Labs in New Jersey. He was one of the members of the lab there, splitting his time between the lab and Canada. And it was quite an amazing time in this lab because there was not just Yoshua, there was also Vladimir Vapnik, Yann Lecan, Patrice Simard, Léon Bottou, Chris Burgess. So it was a small group of really high-powered people. And for me as a student, it was an amazing opportunity to get to know them all. And of course, Yoshua by now is a world star. He received the Turing Award together with Jeff Hinton and Yann Lecan in 2018. He received the Killam Prize in Natural Sciences. He's a fellow of the Royal Society. He directs the Miller Research Lab, one of the top places in the world for machine learning. And he's also a CIFAR fellow and program director. And on top of this, he's someone who deeply cares about making a difference with his work. So when the COVID-19 pandemic took hold, he redirected a large part of his efforts towards helping contribute solve these problems. And today, in the next half hour, he will tell us something about how to use machine learning in risk assessment or contact tracing. Thank you very much.
Thank you, Bernhard. Let me share my screen. Oh, I can't. Okay. Yeah, now it should work. Share my screen. Oh, I can't. I hear myself in echo, though. Is that normal?
I have to say I had the same problem, and maybe while this gets fixed, I can briefly say this is going to be recorded, this meeting. So if you have a problem with that, you can leave and go to the YouTube stream instead, where you see the same thing.
All right, I'm going to get started.
So if you have a problem with that.
By the way, I think the new people who joined are not muted. So anyone who's joined the meeting and is not on mute, please mute. Thanks.
Okay, let's see how this works. Yeah, so like many people at the beginning of this pandemic, I was wondering what I could do about it. And of course, being a scientist in machine learning, I thought, well, what are the areas where we could do something useful? And indeed, very quickly at Mila, many projects started. And I've been involved in 2 or 3. Two of them are really related to drug discovery, and I won't talk about them today, but I find this research really exciting because it could really be helpful not only for COVID-19, but also other diseases in the future. Today, I'm going to focus on this other project, which has taken the bigger part of my time in the last 3 months. That is trying to use machine learning to predict people's contagiousness before they get to have symptoms so that they can be aware that they are contagious and change their behavior. And as it says here, with help from dozens of others, it's actually about 60 people who are involved in this project. So let me say a few words about the coronavirus. There are still a lot of things we don't know, but it looks like contagion is mostly happening by physical proximity to an infectious person. There are also other possible vectors like contact with the surface that has been infected, but these seem to be fairly rare. The other important thing to know about is this viral load curve that you see on the right. So on the x-axis, you see the number of days after symptom onset. So 0 is when symptoms start. On the y-axis, you see the amount of contagiousness, basically the viral load. And what you should notice, first of all, is that the peak of contagiousness is happening even before you start having symptoms. That is for people who eventually have symptoms. There are also people who are asymptomatic. But the good thing about asymptomatic people is that their viral load curve is much lower. It would be something like this, right? So it's like 20% or 10% of the people who eventually get symptoms. So the most interesting cases to change the course of the disease is to try to do something about those people who are pre-symptomatic. They will have symptoms, but they don't. Because there are also studies showing that once people start having symptoms, they change their behavior, and people do. Most people are responsible. They don't want to infect their community, their family, and so on. And so they, as soon as they suspect they might be infected, they change their behavior, and it has a big impact on the reproduction of the virus. And this is really what we're after. Okay. So, so the other thing where we can think of machine learning having an impact is instead of having everyone in the same bag and staying at home or something like this with lockdown, if we could predict that you're contagious or to what degree you're contagious, maybe we could be more selective about who should stay at home and who should be more careful and so on. So this is, of course, an important motivation. Now, manual tracing, digital tracing, contact tracing methods, they do a little bit of that by looking at people who have been diagnosed positive, and then they get in contact with public health, and they are interviewed and asked about who they met in the last 14 days, and then those people are called. Now, this process takes time. At least a day, at least here in Canada. And I think in some places it could be easily 2 days. And given what I told you earlier about the course of the disease, where just a matter of 1 or 2 days can make a difference between being pre-symptomatic and contagious and having symptoms, and a warning is not going to change much. So having these early signals, the time at which we're able to send those signals really can make a big difference. So we really can't afford that delay. So that was a motivation for digital tracing. So digital tracing, as soon as you enter on your phone that you're positive, maybe it's been validated by public health authorities, that information can be propagated to other phones, and then those people will get a warning. Now, the thing with manual the thing with the standard digital tracing that I've been talking about, digital or manual tracing, what I call binary tracing, where you just send a 1 or a 0 when the person is positive, is that it's leaving a lot of money on the table. It's leaving a lot of opportunities to get an earlier and more precise signal. So what information is it missing? So maybe the most important one is the presence of symptoms. There's about a dozen different types of symptoms that could be revealing of the presence of the disease. We know that factors like prior medical conditions, specific ones, can make quite a bit of difference in whether the persons are going to get the disease and how severe it's going to be, and similarly for age and to some extent biological sex. The other thing, of course, is the information you get from other people's phones. So those could be 1s and 0s, or if we are able to make more precise predictions, there could be some kind of real value number or some quantized risk level. In our case, we are quantizing because we want to send as few bits of information as possible for privacy reasons that I'll come back to later. Right, so then the idea in a nutshell is use machine learning to predict your infection status, probability distribution, contagiousness distribution over the last 14 days, given all these clues. And using that, provide early signals to tell people that they should, be more careful, and eventually also help even people with symptoms about good recommendations of what to do according to what public health currently suggests. So this kind of app would have to be done in collaboration with public health because of deciding what the right recommendations should be, and also in order to get validation of the positive tests. So we shouldn't see this as replacing manual tracing, because manual tracers can use information that the phone don't have access to. Like they can interview people, and it's hard for the phones to know whether you're inside or outside, for example. It's hard for the phone to know whether there was air conditioning. And so the phone can make mistakes, like maybe you're close to somebody, but it's through a wall or something. So I think that the two approaches to identifying people who should be careful or should go in quarantine could be complementary. All right. The other thing about making these risk predictions is once you have those risk predictions, they could be useful for public health in many ways. Knowing that a person is at high risk, of course, could be a clue to decide whether or in what order we should test people, like which people should be tested first. The number of contacts that people have can also be a factor. Like if I'm a person who is contagious and is seeing a lot of people in my life, then probably I should be tested early, so that if I get a positive result, I'll be quarantined, and if I get a negative result, I could continue my life, maybe working in healthcare, for example. All right, so now let me try to explain in a little bit more detail how these early graded signals can be helpful. So what we see there are 3 timelines illustrating over a period of 2 weeks what could happen in the life of Jim. So there are 3 cases: the manual tracing on top, the binary tracing app, like the apps that are currently being deployed in Europe, for example, and will be deployed in Canada in July, and an app that uses machine learning, the COVID app that we developed. So Jim, on the Wednesday of the first week, happens to have a risky contact with a person that happens to be contagious. So there's a good chance, if the system is working well, that the phone on that stranger's the phone of that stranger might already have some clue that the person is contagious, and a bit of that information could slightly increase the risk level of Jim, but maybe not enough to make Jim change the way he does things and he might continue to go to work. However, the really important thing is what happens when that stranger starts showing symptoms, because that's a pretty strong clue that the stranger is infected. And so that's happening on the Friday here on the timeline. With a machine learning application that uses the symptoms as a self-reported symptoms, as soon as the stranger puts that information in their phone, an increase in the recommendation level for Jim shows up, and he probably, like many people, would act responsibly and change his behavior. And in fact, as I said, the symptoms is just one. It's not a binary thing. There are many kinds of symptoms. Maybe after a couple of days, the stranger's symptoms actually grow worse, and then the signal on Jim's phone gets stronger. And so he decides on the Monday to actually not go to work, or maybe not go to a party or something. This is essentially how lives would have been saved. Whereas with the binary tracing, Jim would have to wait for the person to get tested, and then one day later get results that eventually that would go back to him. With manual tracing, it would be even worse, because potentially there would be a couple of days more of delay due to the interview process. All right, so it looks like that's a good plan, but this research topic is also quite interesting in that it's not just a machine learning project. There are many other aspects, and maybe foremost is privacy. So privacy is important for human rights reasons, but it's also important because, at least in democracies, these apps typically would not be mandatory. And that means that people will use them only if they're trusting them. And the main concern that people have in polls about these kinds of apps is privacy. Who's going to potentially have access to data I put in my phone? And there are two kinds of fears that are worth thinking about. One is about what we could call the big brother fear, and the other is the little brother fear. So the big brother fear is, say, governments or large companies somehow getting access to information from my phone. And if you ask people what they're most afraid of, is to be tracked by say, government, the police, or something. And yet people don't want these authorities to know who they met, when they met them, and where they were when they did that. And so we need to be really careful about avoiding even creating a file that would contain this contact graph, who met whom, when, and potentially where. The other kind of threat is like your neighbor or people you cross in the street. You don't want them to know your infection status. So that's the little brother attack. And there are different kinds of contact tracing privacy settings, so-called centralized and decentralized. And to maybe simplify a little bit, you could say that the centralized methods are worrisome in terms of the big brother attacks, whereas the decentralized methods, which are the ones that are currently most used around the world, are worrisome because of little brother attacks. Since people seem to be more afraid of big brother than little brother, in our case, we've decided to go with a scheme which is mostly decentralized for the sharing of these risk levels. All right. Now, let's talk a little bit about the machine learning aspects of this. So there are a number of issues that made us choose the approach that we ended up working on. So first of all, the things that you would really like to predict are not actually observed. Things like the level of contagiousness is not a quantity that you actually measure, rarely at least, for most people. And so the thing you'd like to predict is a latent variable. Now, you have some clues about it, like when somebody gets tested positive, then they were contagious in the last few days. And knowing about the typical course of the disease, one could infer when you were contagious and to what degree based on that test result after the fact. And similarly, if you get symptoms, then this also provides statistical clues about being contagious and when you were contagious, again, because we know, this curve that I showed at the beginning, right? The curve on the right, right? So if we start having reporting symptoms, that's like day 0 or 1, that tells us a lot about when the person started being contagious. And so we can infer things about contagiousness based on symptoms or based on test results or a combination of all the clues that are available. Right, so you need to do some sort of probabilistic inference. Now, the optimal kind of probabilistic inference would use all of the information available and use the full contact graph and exchange information between the nodes to perform inference. Now, you could use something like Klupi-Belief propagation, or you could use a Monte Carlo method to sample from the posterior distribution. All of these methods require a lot of messages being exchanged between all the phones, and potentially a lot of iterations to converge to some agreement about, what is the status of each person. So we were concerned about the amount of computation and communication costs that might go with these things. But also another issue is if we want to pool some of that computation and communication in a central server, that would force the existence of a contact graph file that again would violate our desiderata in terms of privacy that I've talked about. And so if you want to avoid a global contact graph file and you want to avoid a very expensive computation on the phones that might be draining the battery and communications bandwidth limitations of phones, we thought we need to maybe think about something else. Another thing that could be interesting to look at, and we looked a little bit at, but I think it would be worth looking at more, is instead of doing the learning in a centralized place with the data collected from the different phones, we could use federated learning where the data stays on the phones, the parameters are in a central server, and the central server exchanges parameters and potentially gradients with the phones. One issue with this is, again, potentially a lot of communication that could, if you have large models, that could be a problem. If you have very small models like linear regression, then it would be fine. Okay, so in the approach that we implemented, we have a kind of hybrid system where, as far as the information that is about the contagious status of people, that information is exchanged peer-to-peer. So in other words, the phones are communicating with each other, not through a central server file that would be accessible by Big Brother. Now, there's a problem with that, again, a privacy issue. So if my phone needs to talk to your phone directly, then the phones would know each other's IP address, and that might reveal too much information again. So if I get a high-risk level signal from somebody close to me that I physically encountered, and I can somehow figure out from the IP address, and it's possible, for example, where that person lives, that would give me too much information about you and your risk level. And so the solution that we've converged to is to use intermediate servers which anonymize the information so that the phones, when they get a message, they don't know from which other phone it's coming, but they just know that in the last 24 hours, they met somebody who had some risk level, okay? So that's the kind of messages we're exchanging between phones, but through these anonymizing servers. And similarly, in order to train the machine learning server, we can use these anonymizing servers so that the machine learning server doesn't know where the data is coming from. And the data, of course, will be de-identified and will be shared only with consent. In other words, people can use the application just for exchanging risk levels. If they wish, they can also share the answers to the medical questionnaires, like they have symptoms and their demographics and so on. in order to train the risk predictor and also provide information to public health in terms of predicting outbreaks. So, so that's the general setup. One other interesting issue that is something at the tension between privacy and machine learning is the problem of repeated contacts. So there's a big difference between I meeting the same person 50 times in the last week and I meeting 50 different persons in the last week. Why is that? Well, think about it. Like if, of course, I'm going to meet my partner 50 times in the last week. I mean, we're going to spend blocks of 15 minutes together many times during the night, of course. But and so really, the worst that could happen if I spend a lot of time with one person is that if she gets infected, I'll probably get it. But that's going to be multiplied by the probability that she gets infected in the first place. I'm approximating the real story is a little bit more complicated, but that's essentially what happens. So if we spend time together, our risk converges to the max of each of our risks, plus a little bit more, but that's roughly a good approximation. However, consider me meeting n different people as n goes to infinity. Even if each of them has a small probability of being infected, it's asymptotically sure I'm going to converge to being infected myself. So you see, in one case, I converge to the other person's risk probability of being infected, say, whereas in the second case, I'm converging to one probability of being infected. So really knowing whether the contact was with somebody I see often or somebody I see for the first time is actually probably an important piece of information. Unfortunately, that comes in contradiction with trying to hide who I'm getting messages from. And so we've implemented several methods to send noisy information about who the person is, or among all the contacts that I have, were these 3 contacts coming from the same person or not? So it's a kind of, think of it like we're doing a kind of clustering, given the information that we're receiving, in order to approximately figure out whether a group of contacts belongs to the same person or not. And we use that as part of our input. Let me say a few words about the little brother issue. So as soon as you go with a decentralized approach, which, as I said, is essentially where most of the world is converging, you have to know that there are serious vulnerabilities. There's like zero privacy as soon as you have bits of information leaving your phone, but you already have lots of bits of information leaving your phone as it is. But let me give an example of what we call the hotel attack. So if you go to a hotel, you register your name, and let's say the hotel has a Bluetooth device in each room, and then one day later, the Bluetooth device gets a message saying, yesterday there were you had an encounter with somebody with a high risk level, and now the hotel owners know that the person in that room yesterday had a high risk level, and so that's it. You have revealed that information. I think there are solutions to this. That they're not technical solutions; they are legal solutions. Like, you really want to tell the hotel owners that they're not allowed to do that, otherwise they're going to pay a big fine or go to jail. And in general, a lot of the little brother attacks can be dealt with using more of a social norms and legal approaches. You can also reduce some of the issues by again, introducing some kind of noise in the system. For example, you don't want to share the exact timestamp of the contact. It's enough to know with a resolution of 1 day, because as I said, it takes about 3 days for you to become infectious. And so it's okay to have plus or minus 1 day here. And that is going to reduce the amount of information about who did I meet. If I meet multiple persons per day, then I can't really know who it was I got that message from. So our predictor uses these answers to questions about their behavior, like whether they wear a mask, whether they use public transport, if they have previous medical conditions, and then for each day, whether they reported symptoms or test results, as well as information from the contacts, like the risk level of the person that they met that day and how long they spent with that person for at what distance. So this is variable length input. And so for this reason, we decided to use a transformer as we could use a recurrent net, but transformers seem to work well. The output that we decided to predict is the contagiousness in the past and the contagiousness now. Why? Because if I met somebody 5 days ago, what that other person really wants to know is not whether I'm contagious now, but whether I was contagious 5 days ago. By the way, and this is something that you don't get if you just do binary tracing. Okay, let me skip a little bit. Yeah, so the last thing technical I want to mention is, well, how are we going to train these things if we only observe the things like the answers to questionnaires and those risk levels? Let's call that X, everything that the phone can observe, whereas the thing we want to predict, which is contagiousness, is not observed. Well, we can use something like EM or variational methods in order to make guesses about those latent variables. Now, to make those guesses really strong, what you want to do is have a generative model of the joint distribution of the latent variables Z and the observed data X, which incorporates things like this viral load curve that I mentioned at the beginning and multiple times, right? So this kind of epidemiological model could be built in the generative model of the joint of X and Z. And so this is exactly what we've done. And once you have that, you can use something similar to EM. We use the amortized variational inference, which is similar to what you have in variational autoencoders. But the idea is, given, say, if you know P, then you can just train the predictor by supervised learning. And if you don't know P, then you could use a variational bound, which is a single function that you can, over which you can optimize both free parameters of P, your joint generative model, and your predictor Q, which is the thing that you'll have on the phone that predicts the latent variables given the observed things. All right, I'm not going to talk about the epidemiological model. It's a very interesting part of the work. I'll just use the last 2 minutes to tell you about social and ethical and governance aspects. So I've already mentioned that privacy as a human right is a very important consideration in this kind of work. But, and of course, the safety and freedom of people, we're trying to save lives and allow people to go out of home when they're not contagious. But there's also dignity, right? So there's been cases where the information had about people's infectiousness had been made public and created stigmatization. So we need to make sure that the design of the app, not just the machine learning enter, is going to be mindful of this and avoid things like having an app that tells you when you cross somebody that person is infected, for example. Also, we need to be doing things like informed consent properly. That, whatever information people share, they need to understand what it is about. People should be able to ask that their data be deleted. And if there's going to be any centralized data, there's the question of how should that data be governed? And there are many possibly good choices here. What we have proposed is to use a form of data trust. In other words, an independent nonprofit organization whose sole mission is to manage that data, protecting the rights of the people who share their data. All right, so I'm going to stop here to allow people to have questions. Oh, I forgot results. So basically, it looks like using these extra clues helps us to reduce the number of cases and helps us reduce the reproduction number of the disease. But we still have a lot more work to do on our simulation. So I'll take your questions now. And I also want to say that a lot of people were involved in this work, and we have an archive paper called the COVID white paper, where you can find like 60 pages of details. And I guess when we have an even more detailed thing on the machine learning that is coming up pretty soon. Thank you.
Thank you very much, Joshua, for this fascinating talk about how to connect AI, machine learning, and this pressing problem of contact tracing done privately. So I'm sure we have a number of questions. I have already received 3 of them. So let's try to go through as many as possible. First one is, what are the potential adversarial attacks against this distributed system? For instance, can a group of people make some fake contacts to fool the system?
Yeah, there are many possible attacks. So they're mostly of the little brother variety. So, for example, if you have different people make multiple measurements. Someone else is speaking. Anyways, so for example, in my example of the hotel attack, you would need to have a Bluetooth device for each room. And that seems like pretty expensive and complicated, but there's a way where you can get away with log of the number of rooms by having a coordinated attack where multiple like employees would go around the rooms and measure things. So, and that could be replicated in other settings. So none of these approaches are foolproof in terms of, but the nice thing about the Bluetooth approaches is, in order to do any of these attacks, you would still need to have physical presence. Right? So that's kind of protection. You can't have somebody spoofing from far away and getting information on you. They would have to come close physically in order to measure information from you.
Okay, so the second question is, what kind of information, for instance, symptoms, are users of the COVID app asked to provide, and how frequently are they asked to do so? So to what extent, and also to what extent did privacy considerations influence the choice of questions?
Yeah. So in terms of the symptoms, there's like 12 possible symptoms, and then people can have different degrees of these symptoms. But we don't like prompt people for symptoms every day unless we suspect that they might be, in the at-risk category. So we have 4 recommendation levels. If you're in 0, there's like no clue that there's a problem, and so we don't even ask you any question, but you can go in the menu and decide to enter symptoms yourself. If you're in a higher level of category, then we'll start asking you more frequently to check whether you had symptoms.
So I'm going to ask another of the online questions, but already warn people now, the ones that are on the Zoom conference, maybe we'll allow a few live questions. So if you have a live questions, start thinking about it. So the next online question is, apart from privacy, can you comment on the security concerns? So
Yeah, sure.
what if the system gets hacked and the communication is manipulated between devices?
Yes, there are many hacking opportunities here. So the white paper actually covers in many pages these cases. So one potential issue is somebody could hack the code of the app and have a fake app, which, I mean, they would need to do something like this in my example with the hotel attack, right? Because the app as it is done does not tell you directly about individual contacts. So the phone is measuring things, but it's not telling the user. Okay, so that's one protection. But of course, that protection can be easily removed by a hacker who writes their own app that satisfies the same communication protocol. And that's what I assumed in my previous example. There are also security issues with, and by the way, there are ways to mitigate this to some extent, like newer phones have a protocol that allowed to identify the phone. And so that would allow to mitigate these things. But unfortunately, older phones would still be susceptible to these attacks. If you have any kind of centralized data like we have for training the predictor, then again, you have security issues. So I've already mentioned the sort of cryptographic methods quickly to make sure the information that is being communicated is untraceable, like we don't know where it comes from, but there's always a risk of re-identification, right? So if I know a lot of things about you, like if I know about your diseases and I know your sex and your age, then I might be able to figure out, if I steal the central file, I might be able to figure out your risk level, assuming this is a small enough community. And so we need to protect those data just like you would protect, say, the medical database in a hospital. And so there are ways to do that. They're not perfect, but I think we all live with that risk already.
Okay, so shall we take a live question? Would anyone like to ask? Please unmute yourself if you want to ask live.
I can ask a question if you want. I already submitted it actually, so it's also on the system. But so I was wondering, so thanks for the great talk, by the way, Joshua, it was very interesting.
Thanks, Max.
So I wonder about encryption protocols. So of course you can also make things private by just encrypting everything, and in particular, homomorphic encryption is kind of cool in a sense. But is it? Do you think it's too expensive, or
yes, it's way too expensive.
I see.
We're not ready for that, unfortunately. That would be so. Earlier I said that any encryption is can be cheated, but except of course the homomorphic encryption, as far as I know. But it's just not computationally reasonable, especially on phones, right? And
even if you only do additions, you manage to get everything down to just additions.
Yeah, that could work. I'm not enough of an expert, but that would severely restrict the type of computation you can do and the amount of computation you can do. Yeah.
Thank you.
Okay, so maybe one last question. Does someone have a last question live? Otherwise, I'll go for another online one.
Hi, can anyone see me? Hi, I was wondering which underlying protocol you went for and whether you'd considered the compatibility with the Google Apple protocol in the framework.
Yes, very good question. So we did consider the Apple Google protocol. What we have implemented right now is based on a mixnet procedure, which allows to provide these anonymous communications between entities. Now, they are safe to the extent that no attacker can simultaneously attack all the mixnet servers. But that's not a perfect protection, but it's that's the protection, which is not bad. In terms of the Apple Google protocol, we started implementing for the Apple Google protocol, but there's still one issue which they might fix, and so it could be ported to the Apple Google protocol. The issue is that currently their API requires you to provide to get the users to provide consent each time you extract keys from the API. That is to share information about who I've met recently, and I mean what the keys of those people, and in the case where you only send this yes, no, I've been infected, it's okay because it's going to happen only once. But if you have risk levels, and the risk levels are going to evolve over time, even after you start sending like a low risk level, not zero, you're going to want to keep track of the contacts. You're not going to go in quarantine right away. And so you're going to want to continue extracting keys from your phone. You're going to continue meeting people and wanting to be able to tell them about your new status. And so that would require people to essentially provide consent every day, which is not very convenient. Now, we've been petitioning Apple and Google so that they allow us to do something like only ask consent once every week or something. That would become feasible, and then it could work there.
But would it, sorry, follow-up question, would your framework still work given that the actual contacts are hidden in the API, so you wouldn't have access to them? Oh, right, okay.
Yeah.
Cool.
I mean, so the Apple Google interface provides what we need, which is the duration, the estimated duration and estimated distance.
Okay, Joshua.
They have a risk level already, so it pretty much has all the information we need.
Sorry. So I would like to thank you again very much for saving us on short notice. Also on behalf of my colleagues, Catherine Kuchenbecker, Metin Sethi, Michael Black, for whom I think this was a very nice birthday present today. So thanks, Joshua. And for all those who are going to the CFAR Ellis workshop, there's a separate Zoom link, which you should have received. So see you again there soon. And I would like to thank all the audience for your clever questions and for the participation. And let's try to solve this problem together. Thank you.
Thanks a lot, Bernard. Bye.